quick overview for today's session. As we've done in the past, a scan overview. Paul and I are going to look at two separate scans. We're going to look at an 8x8 scan. We're going to look at a 16x9 scan. Paul's going to be going through single site implant, specifically to the 3D pan window and navigating through there. Followed, I will be using the sectional window to go through a larger case, fully edentulous case, looking at multiple implants in the mandible there. As we go through that, we're going to look at customizing our settings, setting implants per tooth, other specific settings for the implants. Data export, how do we export this to either our labs or dental partners? Also patient consultation, we've planned this case, but now what do we do with that? And then guided surgery. At what point are we looking for guided surgery for some of these cases? So that's going to be one of our other topics that's been very popular there. This is, disclaimer, this treatment plan presentation is intended to demonstrate the features and functions of the Vatech treatment software. As a clinician, it's your responsibility to utilize these tools along with your own expertise and professional judgment to create and implement a successful treatment plan for your patients. Well, let's go ahead and start with our Vatech, the Ez3D-i software here. I pulled up my Ez3D-i. We've searched for two patients. I have them both labeled April 15th so we can identify them easily. And Paul, I think you're going to start with the April 8th. We've taken some screenshots at the top up here. We have a pan and a 8x8 scan down here. What would you like to start with, Paul?
Let's go ahead and take a look at the 2D panel first. Let's take a look at that, double click on that and bring that up. So this panel right here is a really nice pan. In particular, there's a couple areas of concern we can see right off the bat. We have the impacted tooth on tooth number 16 up there, so we can clearly see that. Looks like there may be undeveloped tooth next to that too, but particularly I want to focus on tooth number 9, which you can kind of see a little bit of radiolucency near the root there, but I want to just kind of point out the difference seeing it on here versus the CBCT. This patient actually ran into a pole and the tooth is necrotic, so just wanted to point that out on the 2D panel. So let's go ahead and open up the CBCT now. So we can open it from here. We can either double click down on the bottom because we are in the viewer tab, or we can go back to the patient tab and double click it from there. So either way.
So let me go ahead and look here, Paul. Yeah, and then we'll go ahead and open it here. So here's our 8x8 scan that we've opened.
Great. So let's take a look at it, kind of scrolling through it from the superior border down to the inferior on the axial tab. So if we just go ahead and right click on this axial tab here, let's switch it to main menu. Also, what I like to do is if we can click on the sharpening on the left-hand windowing section, we can see we have sharpen and max sharpen. I always like to see a crisp image. Again, that's a little bit of personal preference, but scrolling down this axial view, let's take a look at what we see as we scroll. We're going to push it all the way to the top of the superior border. You can see it's the blue line and the sagittal slice to the right. You can see where that blue line is. That's where we are positioned. So if we just scroll down with our mouse wheel there, we can see the nasal septum there. We'll see the sinuses as we scroll through there, the maxillary sinus, the nasal concha there. Just scrolling down. And as we kind of get to a little bit down further, we can see some areas of abnormality. Number 9 there. That root or the radiolucent area, we can definitely see the difference between that, the left and the right side there. And in the molar area, we can see the radiopaque area around the molars there. So and we'll take a look at that in more detail when we get to the 3D pan. So as we scroll down some more, keep going inferior there, we can see the incisive canal as we go. We see number 9 there. We can see how wide that canal is as we scroll through it as well, and we can see the void or communication there area, and just the difference and how wide that canal is. So let's keep scrolling there, Jim.
Sounds good.
You can see the roots there very nicely as we scroll through it. Then we get to the airspace there, and there's where the bite stick shows up on the scan.
Yeah, Paul, you and I talked about this beforehand and wanted to kind of point out, look where the patient is biting on the bite stick. So I can really see right here, the bite stick groove. And actually I'm cutting off the labial edge of the patient here. So we're
Right.
missing part of the anterior tooth there.
Right.
So we want to ensure that the patient is properly in the bite stick groove, so we don't miss any of our anatomy here. Now, maybe by moving them forward, we may have been capturing a little further posterior, but we don't want to take the chance on having to take the scan again because we missed some anatomy due to some malpositioning here. So should we keep scrolling down?
Yeah, let's keep scrolling on that axial slice down towards the inferior border. See those roots nicely, and then we'll see the mental foramen coming up here soon, right there on each side. And as we scroll down, see the hyoid bone, and then we're at the end of our scan down there.
Perfect.
So I really want to focus. Yeah, go ahead, Jim.
Now, where do you want to go next on our scan here?
Let's focus in on tooth number 9. So quick way to do it, you can either double click it on the axial slice or right on that 3D pan. If we just click right in the center of that tooth, it'll kind of focus field in right in that tooth. But I really want to focus on the 3D pan here. So we see a really good view of it there. But what I think one thing that makes this software really, really special is the 3D pan tab, which was designed for, in my opinion, pretty much all clinical aspects in mind, from implant planning, crack and fracture detection, to patient presentation, in a way that makes it really easy to understand for both the clinician and the patient. So, so it's kind of a one-stop shop, I like to say. So we're going to focus in on a few things here. So you can see that we have our setting defaulted to the pan rendering view, but I like to use the MIP, the maximum intensity projection filter, on the left. So if we click that, I prefer to use that because you can see the ridge really well. So it's really nice for implant planning. So we're going to just position our navigation box basically over what we want to look at. So let's start with that impacted molar up on number 16. So we can place it there. We can angle it how we want it with those blue dots on the left and right side there. And we can kind of scroll on those section slices to move left and right on there as well. We can look at that, what appears to be an undeveloped tooth there. We can see that. We could rotate around the box if we want to grab the blue dots and rotate around that position just to get a better view of it. So it's really kind of a customizable view here. But again, I want to focus on tooth number 9. So a quick and easy way, again, just double click on the tooth, the center of the tooth. It'll focus that box right in the center of the tooth. You have your 3 slices there, which are represented by the sections on the bottom, the 3, 24, 25, 26, which obviously are fluid and move as you scroll through those slices. So we're basically, we're going to place an implant here, but we're going to focus in the red line in the center. We're going to angle it the same angle as we want our implant. So we can adjust it with those blue dots. We want their center red slice, which is the slice in the middle. And we can position the blue line. A good place to position the blue line is kind of at the ridge in general. And then we can scroll on the slices on the bottom. We need to adjust that. But if we right click on the slice itself, that's how we change our interval. Again, really important. Intervals, the distance between your slices. We'll have ours set to 1 millimeter there, which you could change if necessary. There. So from there, we can just simply measure. We can see the abnormality right there in that slice. So we're going to measure and put our implant in. So we click on our measuring tool on the toolbar on top, and then we'll measure from the ridge to the tip there, and we can do the same labial to palatal area as well. And you can kind of keep measuring until you want to turn your tool off and just do a right click to turn it off. So from there, we could take a screenshot if we want to capture those measurements with the camera up there. Usually it'll say save database there, but now we can just simply right click and hide our implants if you want, or delete them, either way. And we'll go ahead and we're going to click insert implant on the left, and it's going to place it right at that angle on that slice. So we'll click on insert implant, right? So just kind of talking about this box for a second. So we can do single or multiple. So either way, we're going to do single for this demonstration.
Sounds good, Paul. On signal here.
We'll choose our tooth number first, right?
Go to
so number 9. And so you can see the company there in the lineup. So we have ours defaulted to Strawman, which obviously you could change the defaults there. So we choose our company. We have our lineup, you know, the different brands, the different models there. Before you hit set as default, always, if you want to make it a default, if yours is not defaulted, pick the size first. So we're going to use the 4 by 10 by 10. So the occlusal and apical diameter columns, and then we have the length, right? So we're going to click that, and then we're going to click set as default. Now ours is already set, but if yours is not, just click that. It'll make it the default. But just keep in mind one thing: it only defaults it for that one tooth. So we have it kind of so it's kind of customizable because you may want different implants on assigned to different teeth. So that's why it's set up like that. But so you can set each tooth, and you can do that in the settings also before you get to this point. But each tooth number could have a separate default. So from there on the bottom, well, let's talk about the crown. So the crown on the left side in the corner, we're gonna just attach that to this implant right off the bat. And you can see to the right of that, there's the color. It's set to yellow, but you could change it to, you know, white or whatever color you prefer. Hit OK there. And then we have axis and click point. What axis does, it's personal preference. Axis will place it directly on the slice directly. Click point, a little box pops up and you have to navigate where you want to place it. So for this purpose, we're going to use click point, and we're going to click insert, and this box will pop up, and you simply place the cursor over where you want to put the implant. So you can see the cursor has the little implant icon. It's just waiting for you to click. So we're going to put it right on the 3D, and you can put it on the 3D pan or the section tab, either way. We're going to put it on the 3D pan. We're going to click. It's going to place our implant. Okay, and then we're going to then I like to focus in on the section slices, right? So if we click on the implant, hover over it, you'll get a crosshair, and then you can move it in either direction from there. And we can tilt it. So we can tilt it, you know, near the apex or the occlusal area, but it has that axis tilt line on each side. So we can direct it that way. Great. Perfect. So a couple right-click options here on the implant. So if we right-click on it, we get our menu. So property will bring us back to the property window where we kind of started from if you need to change the implant altogether, the company, or anything else, the tooth number, etc. So we'll hit cancel there and go back and right-click on the implant again. Obviously, you can hide, delete it. Show info, if you're wondering if you wondered what implant you put in there and you can't tell, you can right click on it, show info. You know, you may want to take a screenshot, you know, those types of things. So that'll show or hide the information there. So we can go ahead, right click and hide it. So if we go ahead and you can also do it on the 3D pan, same thing. So if we right click on it again, we can edit the implant. It's the quickest way to change the size. So we have the length, the occlusal, apical sizes, but it's only from that one particular manufacturer. So basically what's in the library already. So we can go there, and then we'll do another right click. And then, so you can copy the implant. If you're doing multiple, you could just copy that, go to your next position and paste it. But an important thing is the lock feature. So after you do your implant, it's a good idea to lock it, especially if you're doing multiple, so you don't accidentally move it when you move on to the next implant. So you can right click, you can see there's a padlock displaying when we try to click on it. So to unlock it, lock it or unlock it, basically just right click on it, and see, now we can unlock it. So there, perfect. Okay, so anything you want to add, Jim?
Yeah, let's talk about one more thing over here. Another quick way to place an implant. Let's go over here to number 8 really quick. We get this question a lot, and using this for, you know, kind of patient education here. Let's say I'm a patient and I come in and we do need to place an implant here. One quick way to do this, I can come here to my measurement tool. I can come down and just draw a line or take a measurement. And then with a right click feature, we can just go down to insert implant, and we're going to place our implant here. So a lot of my doctors have shared with me that, you know, the patient themselves really doesn't care what brand implant. We can use this as an educational tool for our patients to talk to them, saying, hey, we do have enough bone here, or no, it's a good area for an implant. So think about using that measurement tool where you just go to measure, you click here, and then you right click, and it will put your implant right along that long axis. And it does pick from a generic set of implants there, but you can set it to one company if you would like to do that. So that's one of the other things that I wanted to add there. But yeah, want to go on to the other right click features?
Yeah, let's take a look at the crown. So looking at that crown there, I want to flip it up and get an occlusal surface view because I want to kind of customize that crown, just kind of demonstrate that. So if we flip that up, yep, in that occlusal view, we have this nice feature to our software is called clipping. So yep, it's easier to position it where you want to move it first. Click on apply clipping, and you can see in the lower left-hand corner there, we can choose the direction. So whether you want to cut it sagittally, axially, just pick your direction. So we're going to use axial. We're essentially going to get rid of the lower arch, or just kind of cut away from it. So there's a foot and a head slider. So if we go ahead and we'll just grab our slider and slide all the way up until we essentially remove the lower arch there. There we can see a nice occlusal view. You could adjust that if necessary. But if we right-click on the crown itself, we can use this really nice tool called Show Controller. And it's basically, it's like a globe kind of an object. And you can basically turn it in any direction, tilt it left or right, palatal, labial, any direction you want. So we're going to kind of just adjust that so it looks a little more realistic there. Yep. Looks good.
All right.
And then the other option here is another right click. If we right click on it, we can also easily change the size. So if you click on edit crown, similar to edit implant, you can change, again, same thing, mesial, distal, lingual buccal, and the height, change the size that way. Yeah, perfect. So that's editing the crown a little bit. If we go ahead and click on the implant, it'll bring up our bone density in that little bone density section, which if yours is not set to here, by default, I think the layout is not set to the bone density setting to display there. So if you do want that, you can click on edit layout, or sorry, change layout. And you can see we have ours defaulted to that third one. So, and that's really nice because it does show that all the time, that implant bone density section there. So you see it's displayed in colors. It's what it's doing is it's measuring around that implant site right there as we rotate around it, and it's in Hounsfield units, which is on the left, and that's the color scale. So what that little green kind of that arrow thing that's floating there is referring to the arrow next door there to the scout. So it's basically showing you the direction. So you can see that that arrow is facing the facial side right now, as you move it around. The scale there, again, is Hounsfield units, where 0 is distilled water, -1,000 is air. So, and also we have the bone density click box in the windowing section. So, you can measure it before you put your implant, after, but if we click that bone density checkbox, we get a measurement reading, and you can see on that section slice where areas may be more dense or less dense. And if you want to see another scale, we can click on the little gear that's next to the words bone density on the left, and it will display this nice graph here. And you can see what the colors are representing, what the software is assuming is going on in that space. You have the blue, kind of the rainbow colors. So you have the blue is D1, you have D2 for green, D3, D4, D5, and then again, you have the Hounsfield units on the bottom. Perfect.
Perfect. And that's another thing to note. This bone density is only in the 3D pan window. That's the only icon we have it there. Yeah. Perfect. All right.
Great. So then the final touch, as I like to call it. So we can rotate around the implant. So an easy, quick way to do it in here is on that scout view. We have the little blue buttons, L and B for lingual buccal. You can grab them, and as you click them and rotate around, you can see it's moving on the section slice all the way around the implant. The one thing about it is you're not directly on it. So what I like to do is actually use the oblique tool. That's kind of the final step here to rotate around it so it's on the same axis. So if we go back to the MPR tab, that's where our oblique tool is located. You can see it on the left side, oblique. But before we click it, we want to center whatever we want to rotate around, in this case, it's the implant to our axis point. So it's really easy. If you just right-click on the implant and select Start Oblique Menu, it'll align the entire axis to that implant. So you're right in the center of it, so you'll get a full view of it. And so this is our oblique mode. So we have our oblique window in the upper left here. So that's we're focusing in on that. And then on our axial view, you can see we have that orange-red line, which is the slice on the left. Okay, so the green boxes there basically expand or contrast the view as we flip those or move those there. And then we can grab right there, and you see the double arrow, kind of the little wavy arrows. You can click that and rotate around the fixed point, which is the green dot in the center. In this case, it's the implant. And the arrow is the direction. So it's telling us that that upper left image we're looking right now from the lingual side. You know, whatever, it just basically moves with it fluidly and shows us the direction. We can see that abnormality there very well. We could take a screenshot, and you can also move the implant in here. So if you are rotating the implant and you realize you're not in the bone or something like that, you can simply grab it on the oblique window and move it or tilt it as needed. So you have all those functionalities you do on the 3D pan tab there.
Nice, Paul. Any other thing you need to add on that, Paul?
No, I think pretty good here. Looking forward to seeing some multiple implants, Jim.
Right. Now, I do have one question that came in is, can we plan from the crown down? So we do have the option there to basically, we could delete everything, and then we could start with our insert implant, place the crown, and then work backwards. So that is another option to be able to do. So that is one question that did just come in. We'll talk about that maybe towards the end or in the Q&A session for that there. Okay. So
one question I got, I just sorry to interrupt you. It said, where did you get the oblique tool? Where's the button for the oblique tool that we just talked about? So it's on the NPR tab right there in the upper left. You see oblique there.
Yeah, so I can either click on this, which allows me to navigate to my oblique area. But what we did is we had an implant placed, right, and we right-clicked on that implant. So if I was doing this for a certain tooth, what we could do is we could click back here for tooth number 9. We could go to the center there through that canal. We could rotate all of our lines to get through the long axis, and then click on oblique, and then our axial window, click on that center point, and now we're rotating around that 360 degrees. If we already have the implant placed, we just right-click, and that's going to set that oblique, all of our axis points through the long axis of our implant there. So, perfect.
Thanks.
All right. Well, let me do this. I'm going to go ahead and close out of our 8x8 here. Let's look at our 16x9. And I'm going to double click. And while this is opening, you know, Paul just covered the 8x8 single side implant using that 3D pan window. We're going to talk a little bit more about that at the end or towards the end on how we're going to take some screenshots and then utilize our consult tabs to talk to our patients and do some patient education through there. And that will kind of lead us into our next couple sessions next week on the 22nd and then the 29th and then also April 6th there. So kind of keep that in mind as this opens. So another thing to think about is, you know, we have 2 scans here. We have an 8x8 and we have our 16x9. So questions I get from doctors is what scan and when? When should I use my larger 16x9 scan, or when should we use our smaller focused field of view? Will the 8x8 scan work adequately? Let's say on this case, we're going to look at like an all-on-4, maybe in the mandible. Can I use my 8x8 or an 8x9 scan specifically for that? So I think we're going to address some of those issues today as we go through this case planning here. All right. So that will be coming up here in a second, and you can see my screen. We can have our 3D screen right here. And I've got my 16x9 scan on there. And as I scroll through, fully edentulous patient, 16x9, we captured our condyles, airway, inferior border of the chin, and well into the sinus, even into the superior sinus there. So one thing I want to talk about here is kind of some positioning, I won't say issues here. I'm going to enlarge my coronal slice here and look where the bottom of our mandible is. really this patient looks tipped to me. Also, it looks like maybe on the sagittal window that the patient's tipped up a little bit high. So these two things could cause some issues with positioning, and really we're going to have to make some extra efforts to move this around to get an accurate image here, or an accurate orientation, I should say. So I'm going to move this forward, and let's scroll here. And what I'm going to do is I'm going to grab my axial slice, so we're going to bring this down, and I'm going to go ahead and get this lined up and rotate. Two different points that I could rotate to get this center. I could go the inferior border of the mandible, or I'm going to use a little mylohyoid ridge right here, get that lined up. And now what we're going to do, see how we have our angle, or our center sagittal slice centered there. I'm going to go ahead and right click on my axial window, switch to main view, and we're going to bring this up to the superior border, just like Paul did on his 8x8 we've done every week. We wanted to look at the patient's overall dental health. Now I'm in my superior sinuses, looking at the cephenoid sinuses. This is going to bring the question of what are we looking at, and when do we consider using a radiologist to review our scans. We can see our external auditory medius here. We're starting to see the zygomatic arch. We can see our condyles, nasal septum, going through our maxillary sinus, just kind of do an overall evaluation. The nasal concha through here, incisive canal. As I'm doing this, I'm looking over here on the right for my axial slice. So let's keep scrolling down here. See our nerve here and here, our airway, getting into the mandible. And now we're starting to see our ridge there. And what I'm looking for really is my mental foramen. So if we did our adjustments right, we should be able to see those somewhat at the same time. I can see over here and over here. So I might need to slightly adjust this to bring that into view so I can see mental foramen here and here. So really see how this patient was, malpositioned a little bit. But I'm going to go with this here, and let's go draw a curve. And we're going to go around the arch. And notice I am following the labial edge of that, because I want to look at, we see where those mental foramens are at. Double click. And now it takes us back to our sectional window. So if you tuned in last week, we did a lot through this sectional window. We're going to look at this again. I could double click here. We'll get our 9 windows over here so we can kind of view what we're seeing. So I'm going to enlarge my panorama view. And we're going to focus right here in the anterior portion. So let's first change our thickness down. I'm going to change that down to 0.5 millimeter. And I'm going to find my mental foramen so I can see, we're going to say here to here. So let's take that measurement. I'm going to go across there. We're about 43. We could come here and we can go to, we'll go about 21.5. And we can move that over a bit. All right. As I scroll through here, we can see we have some recession here. So I'm going to bring this up to my lowest point. And let's go back to our 3D pan, or full view here. Now I am in my slice 72 over here, which corresponds to my vertical slice here. And one thing to note, this green line represents my 0 point here. So I'm going to put a reference line right there. And let's go ahead and enlarge this window. And what I could do now is let's take a measurement across there and see what type of bone we have as we're looking for our ridge. So we're at about 7.5, almost 8. I could probably drag this out. Yep, through there. So I'm going to say we're going to leave it right at that height. Probably what we should first do is trace our nerve. So let's go through here. Let's find our mental foramen. So I can see right over here, there's our mental foramen. I'm going to come over here to trace my nerve, and I'm going to go ahead and click through. If you have questions specifically about tracing the nerve here, we have our video library on our website in our Customer Learning Center. In that Customer Learning Center, we have specific videos on implant planning. We actually also have all of our webinars that we've done, including this one, will be loaded to that Customer Learning Center. So if you have questions on this or other clinical uses, it's a good, valuable reference to look at. Let's go back over here and find our nerve, and I'm going to go towards the anterior and see maybe there's a little branch or a loop there. So let's double click here. I'm going to go over to my right side and come across till I see my mental frame in there. And we can see it here. So I'm going to scroll. You can also scroll here on the panorama view. We can go out labial and back through. All right. So let's go to our nerve again. And I'm going to go click through. And we can click here. And I'm just going to follow the center of that bundle. I'm seeing my bundle here. A couple other things about the nerve here. I have mine color changed to yellow. You can do that in your properties. Also the diameter. Right now mine is set right to 2 millimeters. If you wanted to change that, you could change that and customize that. And that's where you're going to do that. So let's go back anterior. All right, let's come up to our nerve. And I'm going to go ahead and click, and we'll trace and click. And we're going to double click. And now we can see as we scroll through here, we can see our nerve traced on there. So I'm going to come up here and I'm going to scroll. And this time I'm going to go ahead and draw another curve through here. And this time I'm going to go right through the center of the ridge. And let's double click. And what I want to do now is find our nerve so we can see them here. We had our measurements there. Let's go ahead and take those again. Actually, let's do this. Let's go ahead and go over to insert implant. And we're going to go ahead and place our implants here. So Paul talked about single. I'm going to do multiple here. And I'm going to go for click point. We're going to go 27, 25, 24, and 22. So we're going to place our 4 implants. You can see they're all been preset to Straumann as I click through there. And I'm going to go ahead and click on insert. And I get a lot of questions about how do we parallel to get these implants perfectly parallel. I don't have a magic button that does that within our software, but I can say, let's go ahead and place our first implant. We're going to place it here. We're going to place our second one, 25. We'll go 24, and then we'll go with our 22 there. All right, so those are our implants. So what I would really like to do now is kind of look and see, are we in bone? So I do need to move this, and let's move this first implant, move it back into the bone. We can do our rotation here. We'll rotate that. Let's go across for 25, grab that, move that into bone. We can go ahead and rotate, maybe move this around. All right. So now my question is, how do I get my angle here on 27? First I want to do is I want to place this in bone. I'm going to scroll back across. And what I can do now is I can grab or use my measurement tool, which is this angle tool. So I'm going to come here, draw through the long axis of the implant. We're going to measure out. We're going to find our 30 degrees. Call that 30 degrees there. I can click on the body of my implant, and now I can change my angle to go along that long axis there. Other thing I'm going to do is I'm also going to grab this angle, because right now if I scroll through I can see my implant looks like an oval, so we're basically slicing down the side of the implant there. I want to slice through the long axis of the implant. So as I scroll through here, now we can see our implant through that long axis. Let's come here. If we needed to change this, we could move this around or change our implant there, but I want to go ahead and look at my implant on the other side. I'm going to go ahead and grab my line here. We can grab our vertical line, and we're going to move that back to vertical. We can scroll through and find my implant there. Let's make sure we're in bone. And then let's scroll back here going through. So here's my angle from the closing arch there, or the contralateral arch. We're going to drag this across, make sure we have this set at our 30 degrees. All right, I can then click on the body of my implant. We can rotate through. And let's see if we are right along that axis line at our 30 degrees. Let's double check to make sure we're in bone. So let's rotate this, bring this back across through the long axis of our implant. And we can see that we are through our implant there. So one last time, I'm going to hit spacebar here and let's scroll down to see our implants. And I can see all of our implants placed here. I'm going to go draw a curve one last time around the arch here. And let's double click. And now we can see our implants placed here. So we are at the same trough. So when we do need to trough off this ridge, we are at the same height. And we can scroll across, double check that we are in bone. Going all the way through, we can see that we are far enough away from that nerve. If we do have concerns there, I might go ahead and grab my implant and move that more towards the midline, and then double check to make sure we're in bone, come across. Let's come across here. If we do need to change that a bit, we could grab this and move this more towards the midline there. But now we can see all of our implants placed on there. As we go through that, we may take some photos through here. We could go through and take maybe some smaller photos of a specific area. Let's capture this. So we have our plan on there. So we have our case planned, and let's scroll up and we can see our implants here. And I'm going to go right to the crest of the ridge of all my implants. Talk a little bit about this, maybe talk about AP spread. Really going to use this where I'm going to work with my lab. What type of prosthesis are we placing on here? What materials? So we really need to keep all that in mind. That's where we will talk about using our labs or our prosthodontists on that. But we can do a right click here, switch to main view, and we can see our case plan. So if I did want to show the patient this, we could scroll here. I could use my annotation and my sculpt tool. Let's cut everything out except for our anterior portion here. Let's delete here, and that's going to delete that off of there. So big case, we did not really look at case planning the maxilla. Looks like we're going to be using this for maybe one of our next webinars, so we can look more of that and from a clinician's view of case planning and talking to the patient. But there is our scan. We could talk to the patient. Paul, before you looked at your apply clipping over here, and I'm going to go back to my axial, and this time I'm going to tip down from the head down, and we can cut that down and go through, and we can look at our implants there. And let's reset our clipping there. So, and we could reset our sculpt right here. So a couple of last things. Let's right click on here, switch to main view, and we can measure for our AP spread. So let's go through and trace a line right through the center of our two most anterior implants. Let's trace a line through the distal edge of our posterior implants. And I might need to change this angle here a little bit. Right there. We can take some measurements here. So from our line here and our line here. And now we know that we need to change either 1.5 times that number or 2, depending on the material we're using and the individual setup. No, there's a lot of different clinical questions here. In this, we're just showing how to use the software specifically for the Vatech, what we can do with our software here. So let's go up to there, and then we would draw another line across. And that's going to be our distance for our AP spread specific to that. Let's talk more about the consultation tool. Have our patient come in. We're showing them our videos, and I'm going to go over here to change layout. I think this is a really powerful tool here because what we can do is we can come over here to our favorites list, and let me scroll across, and we can show our patient our videos. We can talk about the denture that they've been wearing. And then how do we incorporate talking about our fixed prosthesis that we're going to be utilizing there. Or we can play, another video, different videos, kind of going through the software, kind of exploring that. There is no sound, but we can talk to the patient here through this. So let's look at our sculpt tool.
Sorry, I had it on mute. Sorry.
That's all right. I'm going to sculpt right through the center of my implant here, and that's supposed to be a straight line, but we'll get pretty close. We can cut out half of our patient here. I'm going to click delete, and that's going to delete the side off of here. Give it a second. And now what I could do is I can rotate this around. We can add some bone here. And now we can actually right click and drag. And I'm using the wheel on my mouse to scroll this closer. I can see my implant in there. Paul talked about using our controller if we need to change that. Also, Paul had talked about right clicking here and locking our implants because don't want to move them on accident. So if I lock these as I rotate around, these will not get moved. I've had doctors say, I did my case planning and all of a sudden I accidentally moved this, and we had some issues there, had to replan. So let's leave it right there. And then thank you to all of our Vatech family out there that attended today. Thanks again.